Hello, everyone. Welcome to Transform 360 podcast, where we explore mental health, well being, relationships, and personal growth. Join us as we empower minds and guide you towards a balanced life. I'm your host, Sabar Shad, and today we are tackling a topic that is often discussed but not always fully understood, and that is why traditional mental health approaches sometimes fail. And joining me today is a dear friend, Mary Parker. She is a clinical director at Infinite Potential Counseling in Round Rock, Texas. She is a certified integrative mental health provider, a neurofeedback provider, and a functional medicine health practitioner. With 15 years of experience, Mary specializes in supporting children, families, individuals through comprehensive integrative care. She is famous for blending biological and psychological interventions and is a trusted expert in the mental health and wellness field. Mary, welcome to the show.
Thank you so much for having me, Saba.
I'm very excited because this is the first podcast and I'm so excited to have Mary here. So let's jump right in. My first question or first point of discussion would be we always talk about traditional mental health and basically refer to approaches where they are rooted in the diagnosis, the therapy, the medications. While these methods have helped countless people, right? But sometimes they're just not perfect, or some people are not just looking for them.
Mhm.
So, would you like to share something about your journey or your patient's journey where you feel that the system fell short?
So I actually got into this field. It
Mm-hmm.
was a second career. I started my adult life as a trained chef and a wedding and event planner. But my son got injured.
Mm-hmm.
His injury happened at 18 months after the DTaP vaccine.
Mm-hmm.
He went from developing normally, walking, talking, and growing, being a happy little boy, to seizures. He lost the ability to walk and talk. And he went backwards pretty severely. The traditional healthcare field as a whole failed him. My answers were essentially, well, I guess he's disabled, and that's what it's going to be. There was no real help or any answers for my son. And we ended up having to go to functional practitioners to go through detox and use diet and other things that had to be changed in his life. We discovered, genetic issues that were in the background that nobody had taken a look at, that probably would have kept him from getting any shots to begin with. Um, the traditional healthcare field looks at everything without including what are the genetics, what are the biological things that are going on inside of the body that may make this one size fit all protocol not work for everyone. So I had to go back to school and I learned how to take care of my son and meet all of his needs. And then we had a second incident where he was shook by a daycare provider and suffered a traumatic brain injury. And the mental health field gave him a slew of different diagnoses. Instead of saying this is because he has a brain injury, they gave him 7 different diagnoses, including intermittent explosive disorder, conduct disorder, ADHD, anxiety, like you name it, they
Yeah.
were throwing it at this little boy who was 3 years old. And it was all because of a head injury. And they weren't addressing the head injury. It was basically, we just have to let it go. Here's some medication. And every medicine that he went on made things worse. And he's not the only kid. He's not the only individual like this. I run into people on a consistent basis where the real root of what's going on, what's presenting as physical health or mental health issues, happens to be something that was going on in the background, whether that's a genetic issue, a sensitivity, a toxicity, or some type of deficiency that is being caused by something that they're putting into their body.
That's true. That's true. And thank you for sharing that. That's a very intimate story that no one shares, especially on the social media. So thank you for sharing that, and I'm sure it resonates with a lot of people, a lot of patients we see in our life on daily basis. And thank you for going back to school and being an amazing counselor and starting an amazing practice. And I'm sure you're making difference in life of so many people every day. So thanks for doing what you do every
Thank you.
day.
Yes, you too.
It is. Okay, so next would be another problem. We say, yeah, the healthcare system is broken. So, one other problem that I do feel is that over reliance on one size fit all approach. And what would be your thoughts on how this affects individuals who are, seeking care?
So every single one of us has a different genetic makeup. So just tossing a one size fit all at all of us, it just doesn't work. There are certain genetic issues that can be going on in the background that we have no idea are there that make it so that somebody cannot process a medication or so that they're going to respond in a negative fashion to that medication. So before we put anyone on any type of medication or give them any type of vaccine, we really need to do a genetic workup and see what is their genetic profile. Do they have MTHFR? Do they have COMT? Do they have issues with MAO and DAO? And if they do, how are all of these issues affecting one another? Because the genes are like a ladder. So if we've got one gene on the bottom rung that's switched on in a faulty way, how is it impacting every gene above it? And then what does that mean as far as how are they processing their food? Are they getting vitamin D from their food or from their sunlight? Are they going to have a really negative response to this chemical that we're putting into them that's a pharmaceutical because their liver can't detox it? So before we do anything, we really need to understand the person that's in front of us.
Mhm. That's true. That's true. Hopefully, the traditional system is moving towards one size does not fit all, and especially when we talk about medications and it's genetics is just a part of a life. I usually say it's like just a missing piece of the puzzle, but our environment, what air we are breathing, what we are eating, what we are putting in our body, and there's so much other toxins in our environment.
Absolutely.
Yeah, and there are a lot of things that I got to know about myself when I got my testing done, that I cannot break down. I cannot detoxify cigarette smoke, any kind of chemical. So that was something, and that always gave me a very bad headache. I never had the answer why it happened, but now by knowing how your genetics plays a part, because liver is the main part of detoxifying all kind of substances,
Yep.
so that just made me aware of what I should be avoiding. That's perfect. The next question would be, I understand for mental health, the biggest hurdle would be, a biggest hurdle or challenge would be access and equity. Because traditional mental health care, sometimes it's not even about cost. It's sometimes some people not in that location. There's stigma when we talk about different cultures and religions. So how do you think these barriers, contribute unfortunately to our system's failures?
So, the stigma behind seeking mental health treatment really plays a huge part in why people avoid going and seeking services. A lot of different cultures, think that there's something very, very wrong with you or something very negative if you go to talk to someone about anxiety or depression. But even inside of those cultures, like if we I'm going to point towards the Indian culture. If we look at the Indian culture, they have a Ayurvedic medicine, and all of their medicine is around the fact that if the body is not working the way that it's supposed to, if you're not eating the right diet, if you're not doing these balancing techniques, then you're going to have some kind of physical or mental health diagnosis. They're just not identifying it as those two things being one and the same. Like when we have a physical health issue, we have a mental health issue. They are not on two separate islands. They overlap very, very consistently. So, helping people to see that when we're talking about mental health, we're actually talking about a symptom of a physical health issue that's presenting with a mental health symptom.
That's true. That totally makes sense, and especially with the stigma, it would be helpful for our listeners to know what age ranges do you help.
So when it comes to functional mental health, I work
Mhm.
across the age span. I will do the genetic testing and nutrition testing, even hormone testing,
Mhm.
to see what all is going on for the individual. We even sometimes will order like a stool sample to make sure somebody doesn't have a parasite that could actually be the cause for the mental health symptom that they're experiencing. So when it comes to functional mental health and for neurofeedback, I work across the age span. When it comes to one-to-one counseling, I specialize in kids ages 3 to 12. I love the kiddos that are throwing fits, that are, getting into fights, that are throwing things, breaking things. Sorry, my cat has decided that she wants to say hello.
That's totally fine. We would love to have her on a show.
So those are my favorite in my office as far as one-to-one counseling goes, because we know that these kids that are angry, that are struggling with attention, that are having these type of behavioral outbursts, there is a vitamin deficiency going on in the background, and identifying what that is and how we can fix it is particularly rewarding for me.
That's amazing. Another question that would just arise from that discussion would be, I know there's an uptick in ADHD medications being dispensed and prescribed. That's what we see on daily basis. What would you think? I know COVID has hit it did have its like good parts and bad parts to it, which helped to get rid of some of the stigma. But what do you think? Like, why is there so much increase in ADHD diagnosis? And why people are just running towards a lot of medications and not thinking of trying
Mhm.
to fix the root cause rather than just putting band-aids and just letting things go?
Well, I think the biggest reason that people don't seek root causes is because they're told they're not there. They're told that these kids are just, they just have ADHD. Everybody has
Mhm.
ADHD nowadays.
Mhm.
Most people actually don't have ADHD. A true
Mhm.
ADHD diagnosis is actually particularly rare. Most of these kids are eating a diet that is actually completely deplete of nutrition, because they're eating a diet that is highly processed. And as our food goes through this high process, of being put into the grocery store in frozen containers and inside of plastics and all of those things, our food is actually being completely robbed of every nutrient that it ever had. So our kids don't have the vitamins and the nutrients that they need. And then we live in an environment where there's chemicals and there's plastics in our water and there's things in our air. So unfortunately, most of these kids are actually dealing with not being able to have a nutritious diet because of the environment that we live in. And then they don't have nutritious water or air, again, because of the environments that we're living in right now. So their bodies are actually expressing that they're sick, and it's coming out as what looks like ADHD.
It is. That's true. It's alarming, like how many younger kids nowadays
Mhm.
are getting all kinds of stimulants and other ADHD and other kinds of medications at such a young age. Like someone
Yeah.
getting it at they're just 3 years old, they're just 4 years old. So yeah, that is most of the time. That is heartbreaking
It's
to
also
see.
really difficult because there's not a lot of understanding of what ages and stages are supposed to look like.
Hmm.
When somebody comes into my office and they tell me that their 2-year old just got diagnosed with ADHD and is on Ritalin, I'm like, but why? They're two. They're supposed to be climbing everything and taking everything apart and asking a million and one questions. That's all normal and healthy. A 2-year old is not supposed to sit down and shut up. That's just not their job. Their job at this age is to explore and learn and to figure everything out. So when we are medicating children at such a young age, we're actually impacting their entire life and their growth and development.
That's true. Totally agree with that. And um and another thing that would come out of this is like the same thing what you were saying, kids at different stages of development, they are meant to be kids, right? They are meant to just run and just climb and do whatever they want. So why is there such a disconnect? Because is it because, it is harder to train kids? Do parents need therapy because of their generational traumas? Like what is happening in this circle?
Well, part of it really comes down to what we're being told by schools and the media, right? So
Mm-hmm.
your kid is supposed to come into school in a classroom with 30 other children who are
Mm-hmm.
all there to learn. And if your kid is the one who can't sit down and shut up, there's something wrong with them. When in reality, every single kid in that classroom should be moving around, exploring things, asking questions, taking things apart, because the child's most important job is play. And that is how they do their best learning. So putting them inside of a classroom environment and expecting that they're just going to sit down and be quiet, it's just not a reasonable expectation.
Mm-hmm.
But we are told very consistently that they're supposed to be able to do that, and that they're supposed to want to do that. And the reality is that just isn't true. Biologically speaking, that's not what they're supposed to want to do.
Mm-hmm. So when we say that, so do we need maybe an education on awareness on maybe school level, maybe some media outlets? What needs to be done? Because it's the same thing, yeah, there are a lot of kids who are coming from school and they do fall under the DSM-5 criteria and all of those things. So what would be your quick thoughts on it?
Well, I think that there does need to be a reimagination of our schools. Kids at the younger ages, I don't think should be, and developmentally should not be, sitting down
Mhm.
all day long. They need much more physical activity. They need a lot more movement. They need a lot more play. The best thing that we can do for a child who's under the age of 7 is allow them to go outside, climb a tree, dig in the dirt, play in the creek bed. That's where they belong. They don't
That's
belong
right.
in a classroom. There is a time and a place for sitting down and learning our ABCs and learning how to write and learning our colors. But why can't we integrate that through everyday life? When
That's
we're outside in the garden, what color is this tomato? What color is this bean? What color is this eggplant? There are ways for us to integrate learning into our natural environment that encourages their growth and development. We're actually stunting brain growth and development by taking them out of those physical environments and putting them in a classroom.
That's true. I totally agree with what you're saying. And that hopefully changes with awareness and education, like how mental health has evolved over the years. So hopefully that would also change at some point in time. Okay. My next question would be, maybe given your experience, if you could change, I know there are so many things to change in mental health. It's a very vast topic. It cannot be just discussed in just mere 10, 15, 20 minutes. But if today you could change one thing in this mental health word, maybe some misconceptions or anything, what would that be?
Well, first and foremost, the mental health field is the only field that bases a diagnosis off of observing behavior, as opposed to any testing. There's no blood work, there's no urine testing, there's no looking at the brain or any of the body organs. We're literally going off of a book called the DSM-5, where they say based off of this behavior, you have this diagnosis. And I don't think that it's fair or appropriate when there is lab testing available. There are so many things that we can look at inside of the body to determine what is actually going on before we throw a diagnosis at someone that they do feel stigmatized with. If we can do a test to determine that this kiddo who's being told they have ADHD and intermittent explosive behavior actually just has vitamin deficiency in, 4 or 5 different vitamins and needs a little bit more support, well, why aren't we doing that?
That's true. Yeah, that's another question. Why don't we do that? Why do we have to, like, stick with the old traditional ways of doing things, how things have been done? Yeah, I understand guidelines, they do have a purpose where they would give you guidance, but they're because the same thing, not everyone is same, everyone is unique. So everyone needs personalized care based on how the genetics is, how the environment is, how the where did they grow up. So there are a lot of factors that need to be considered. And I think it's good that we should move from a reactive model to a proactive model
Mhm.
where individuals, they feel empowered and they can take charge, not only of their mental health, but their physical health and their relationships and so many other things.
Absolutely.
And
They just have the knowledge of what it is that they're putting into their body, whether that's food or a medication. What are the long term effects? What are some dangers of using this particular thing? And how is it possibly going to interact with based off of your genetics? What could it do to you? I'm not going to tell somebody, no, you can never eat a Twinkie. I'm never going to eat a Twinkie, but if you have the knowledge that eating that Twinkie is going to possibly have this side effect for you, and maybe there's some negative ingredients in there that are going to down the road cause something particularly detrimental, and you still choose to do it, well, then that's your choice. But right now, people are putting things into their body that are so overloaded with chemicals and things that they have no idea are inside of their food or inside of their water, or inside of their medications. They just are not educated. There's no discussion around it.
that's true. And I think whatever discussion we have, it's unfortunately there's so many people out there, so people just get confused, and sometimes there's so much misinformation. So people, if it was me, then I would be super confused of what to do, what not to do,
Mhm.
what oatmeal to have, what not to have. So it's very confusing, and it's hard for people to find a balance. That's and the last question for you would be, or not probably a question, it's just a I would love you to take a few minutes and tell us about your new book that and the name of the book is Pieces to Purpose.
So, Pieces to Purpose was a multi author book. There's 17 women in the book, and every single one of us is sharing a story of how we took some type of traumatic life event and
Mm-hmm.
turned it into our life's purpose. My story is the story of my son and how he got injured and how I went back to school. And now I spend my life and my voice helping to educate people about, non-traditional paths for mental health, identifying all of the toxins and your genetics, and really understanding yourself so that you do know how to treat both physical and mental health ailments.
That's that's perfect. And is that book available on Amazon? Is there a place if anyone
So,
wants to?
yep, it's available on Amazon.
Mm-hmm.
Anybody can go on there and get it. It will ship right to the house. All of the ladies that were in the book just spoke at the Unbreakable conference on Friday in Austin, and my
Very nice.
understanding is
Mhm.
many of them will also be speaking at the Unbreakable conference in May.
Right. Very nice. That's amazing. I haven't been to that one, so I probably should visit that one at least. Yeah. That's amazing. And I think we would have to invite you back for a neurofeedback session. That's something that I'm really interested to know more because I know I've heard a lot of good stories about how a lot of kids and not just kids but adults they were able to get benefit from it. So probably we'll have another 20-minute session on just neurofeedback.
Okay.
Um, I would love you to come back and maybe share some pictures or how does it work, or maybe just basic stuff so our
Sure.
listeners would get an idea of what is out there and what is particularly in Austin area. And Mary, thank you very much for sharing all your insights and your experiences, sharing your story of how you overcome everything. And it has been a powerful conversation, and I'm sure our listeners will take away a lot from it. And thanks to all our listeners. Thank you for tuning into Transform 360 podcast. Remember that your mental health is a journey, it is unique to you, and it is okay to seek care that truly works for you. And if you enjoyed our today's episode, don't forget to subscribe, share, and leave us a review. Until next time, take care and keep transforming your well being. Thank you very much.
Thank you, Saba.
You're right.